Great. Well, welcome everyone. We're going to get started. I'm sure people will be joining in the next couple of minutes, but welcome and thank you for everybody for joining this webinar. I'm Ellie Oswald, the Executive Director of the Faith to Action Initiative. And today we're going to be discussing the results of a survey that was done several months ago to map out service provided to residential care centers that are transitioning to family care. So thank you to a lot of you who helped form this survey, for many of you who participated in the survey, and a special thank you to our partnership with Changing the Way We Care. We want to let you know that these findings will soon be released in a written report. However, we're hoping that the discussion that we have at the end of this webinar is going to inform the report. So at the end of the webinar, we've left significant time for us to have a conversation. And we'd love for you, while you're going through the presentation, have a pencil and paper out and write down anything that comes to you regarding the data. We're looking for three things: some of the potential implications of the data, any specific questions that you have, areas that are confusing or you don't understand, and then areas where you think it'd be great to have some future learning, future study. So keep those things in mind, write them down as we're going through the presentation, and then please bring them up in the discussion at the end. Now, before we jump in, we want to talk a little bit about why this survey was done, or the rationale for the survey. So what we've seen is we continue to see an increase in global care reform efforts. You know, more and more countries are seeking to align with international standards for care, meaning prioritizing family-based care. And last year's UN resolution on the rights of the child furthered the commitment of all the UN nations to that end. So, of course, the implementation of care reform means that individualized residential care centers or orphanages or children's homes, they need to change and to reintegrate children into family care. Experience has shown us that that transition can be challenging and that it requires guidance and support. And we know significant progress has been made in the last decade to provide that kind of support, to support transitioning organizations, whether it's written guidance and standards, topical trainings, networks created. However, Faith to Action and our partners have recognized a potential gap. We believe that that consulting and coaching that's individualized and contextualized plays a really vital role in ensuring that transitions are safe for children and that they're contributing to broader care reform and system change. However, in recent conversations, Faith to Action has recognized that this type of support seems to be under a bit of strain. Current support providers are reporting they're not able to respond to all the requests for support, and that they've experienced requests increasing, and requests for support we expect to continue to increase. So therefore, this survey set out to identify third-party individuals or organizations who can offer that individualized, contextualized consultation to organizations who are undergoing a transition to family care. So to introduce the findings of the survey, I want to introduce to you all the lead writer for the project, Dr. Laura Horvath. Laura is the Director of Program Development and Community Engagement at Helping Children Worldwide, which supports health and education to build strong communities and families. And Laura has a doctorate in education and herself has supported a transitioning organization. So Laura, first off, thank you so much for your hard work on this project, and over to you.
Thank you, Ellie. It's been a pleasure working with you on this project. I do want to caveat that I have not personally supported a transition. I'm part of an organization that supported a transition, so don't want to take all the credit from all the people that went into helping with that. But I'm excited to share the findings of this report with you. I'm more excited to hear your thoughts on the data that we're about to present. So with that, I'll just go ahead and get started. Here we go. As we've said, the survey was designed to map the support for transition, what's out there currently, including what services were being provided for, where support has happened and where it's planned, what the capacity is and will be for organizations interested in supporting transition moving forward. The survey was developed collaboratively with partners experienced in transitions and care reform, many of you who are on this call, actually. In terms of the methodology that we used, surveys were sent to 134 contacts, including leaders of family care networks, funders, international NGOs, service providers, practitioners, scholars, and consultants. 92 surveys were collected and 67 responses were analyzed in the survey. These, obviously this means that some of the responses were excluded. And the reason for exclusions had to do with duplicate entries or irrelevance. And respondents were deemed irrelevant if they did not support a transition in the past and are not planning to support a transition in the future. So essentially folks that got into the survey without realizing what it was. Consultants were hired then to analyze the data and report the findings, which we're doing right now. Following this presentation, the draft findings report will be mailed out. I think Ellie mentioned that in her introduction, and we'll talk about that toward the end of the presentation as well. We hope that you'll read those findings, and then a series of discussion meetings are planned for next Monday and Thursday to dig in further into the data and the results that came out of the findings report and have further conversation discussion about it. So one survey question looked at the size of the organization's reporting in terms of the number of staff that they have. Most service provider organizations were small. About 69% report having fewer than 50 on their staff, and 28% report having fewer than 10. 31% report having staff larger than 50. These large organizations included such as World Vision, Save the Children, and Catholic Relief Services. We looked at where staff are located, and collectively respondents have staff in 64 countries. However, that number may be higher, as 6 organizations only indicated that they have staff based globally. We believe this likely indicates that they have offices in multiple locations. It should be noted that this data reflects the location of the organization's staff, which does not necessarily indicate that that's where the transition work is occurring. It's also not where organizations are necessarily headquartered. So looking at this map, 88% have staff in Africa, 51% in Central America and the Caribbean, and in Asia. Where organizations are headquartered is a slightly different matter. Organizations' headquarters are located largely in Western countries. I think many of us might have suspected that, but it's about 70% of the respondents are located in Western countries. We also think it's notable to point out that most respondents providing transition support are headquartered in high-income countries, such as the United States, the United Kingdom, 33 in the US, and 7 in the UK. Transition expertise. The vast majority of respondents have supported transition of residential care centers to family care, 86% to be exact. More than half have not themselves experienced their own transition. So where is transition support happening? Collectively, respondents indicated that they supported approximately 1,500 organizations transitioning residential care centers to family care in 61 countries. However, we have to point out that due to the design of the survey question, the locations of all of these transitioning organizations were not provided. However, we can make an assessment regarding the concentration of support from those who did include the names and locations of where they supported the transitions. In addition to the countries listed here, Ethiopia, Thailand, and Zambia were cited 5 times each. And just a little bit of an explanation about the survey question. If you don't remember the question from January when you probably answered it, the survey question asked which organizations you've worked with in their transition from residential care to family care. If it was less than 5, you were asked to list the organization and the country for each, but if it was more than 5, we asked you to please instead include the estimated number of organizations and the countries where you've done the work. So the open-endedness of that question makes it hard to pin it down precisely. Locations of this is just another look at the location of transition support. This slide shows us by region. These numbers represent transitions. So 45 transitions were reported in Africa, 37 in Latin America, 35 in Asia, and 27 in Europe. However, the actual number of residential care centers that have received transition support is likely to be greater than the figures that we have. The survey questions were open fields, and therefore some respondents did not list the exact number and or the location of the organizations they've supported, and instead gave answers such as globally or in hundreds of nations. Where are respondents planning to support future transition in the future? So support is planned in 44 countries. If we look at that by region, 42 transitions are planned in Asia, 37 in Africa, 32 in Latin America, with 23 of those in Central America and 9 in South America and 9 in Europe. Looking at that a little more comparatively, the data is suggesting to us that there are growing efforts to support transitions in India, Kenya, Nepal, Peru, and Zambia. Mexico and Tanzania are also growing, but at a slightly slower pace. The data also suggests that Cambodia, Haiti, and Uganda will remain stable with significant transition support continuing in these locations. And then again, based on the data, the countries which seem to be declining in future transition support include Ethiopia, Paraguay, Romania, and Ukraine. The survey listed 13 different transition activities that respondents could choose from. Educating leadership on the importance of transition to family care, engaging the government, establishing partnerships, case management, strategy planning, building community awareness, assessing children and families, preparing children and families, adjusting and/or training staff, donor and board engagement, building use, family tracing, and the development of new programs. The average respondent had supported 10 of the 13 activities. 26 respondents, or about 39%, have supported all of the activities. Most respondents indicated that they had introduced the importance of family-based care to the leadership of a residential care center in transition, 92.5% to be precise. The second most common activity reported was supporting organizations in government engagement and linking to systems reform. That came in at 88%. Social work and case management and community awareness all came in above 80%. Lower percentages were seen in the categories of family tracing, that's about 55%, staffing adjustments about 44%, and building use about 39%, about 40%. Looking a little more closely at what is meant by development of new programs, respondents reported developing new programs in family strengthening, 70%. 64.3% listed alternative family care, and advocacy was reported 56%, or 56% reported that being an activity they're going to engage in. 33% cited just simply other. We think these activities may shed light on what activities or these results may shed light on what activities the transitioning residential care centers are implementing. But further areas of research could explore if there is a difference between residential care centers that do not receive individualized consulting services versus those that do, how these new activities align or don't with the needs of the children and families within a specific context, and what are the decision-making processes that will help determine the focus of new programming. Moving now from what has been done to what is being planned, in response to the question, what transition support activities are you planning? The most common future transition activities reported include support for donor board engagement, 50%, in developing new programs, 49.2%, transitioning use of buildings, 46.2%, strategy of planning, 44.7%, adjusting and training staff, another 44.7%, partnering and building community awareness also both came in at 44.7%. Less common future transition activities reported that are being planned include providing training for case management, that was 38.8%, the preparation of children and families for reintegration, that's 38.8%, government engagement, 37.3%, assessment of children and families, 34%, educating leadership, 37.3%, and family tracing, 28.5%. So we also then looked at not just the activities that organizations were supporting, but the methods that they used. The survey listed 8 methods used to support transition that included coaching or mentoring, on-site visits or meetings, connecting to others or building a network, on-site training, phone calls or video conferencing, providing standards, written guidance, or tools for transition, and providing funding and providing online training. The average respondent has used 6 out of 8 of those methods, and 15% of respondents reported having used all of the methods. To break it down more specifically, most commonly respondents have supported transitions through general coaching or consulting, that's 86.5%, on-site visits, 83.5%, and connecting with others or building a network, 82%. Respondents commonly provided on-site training and meetings, 76% of them did. 74.6% conducted these over the phone or video conference. 73% provided written standards, written guidance, or tools for transition. The least common support mechanism being used are providing funding, 46% did that, and only 28% provided online training. So what methods do respondents plan to use in the future to support transitions? Interestingly, online training was the most common method planned for future support. It came in at 58% compared to the 28% that reported they have provided support using online training in the past. Other planned methods include on-site training, 52%, provision of standards, written guidance, or tools for transitioning, 50.7%, connecting with others and building a network, 49%, coaching, 44.7%, phone calls, video conferencing, 47.7%, and on-site visits and meetings were 46%. This survey question gave respondents the opportunity to select all that applied. There were a few methods that respondents indicated they will never use. A significant number of respondents reported that they will never provide funding to transitioning organizations. That was about 40%. And almost a quarter, 23.8% of the respondents say they will never provide online training for transition. So now we look at capacity. What capacity do organizations have to continue to support transitions? 44% have some capacity to support the full transition. So if you take those first two bullet points together, 40% that could support an entire transition if provided some resources, and 4% who currently have the capacity without any additional resources. We have to note that on top of that, though, 88% of the respondents reported desire to increase their capacity to support full transition. So if you're looking at 44% that have some capacity, if they're given some resources, the reality is 88% of them want that capacity. The remaining respondents were more severely limited in their future capacity to support transitions. 28% report that they could support certain aspects of the transition process if they're sufficiently resourced, and 7.4% say they could support limited stages of transition only, regardless of whether or not they're given resources. Approximately 12% indicated that they could only provide limited support through technology, such as phone calls, emails, and video conferencing. And a mere 1% indicated they only had the capacity to direct organizations to relevant resources and other contacts to support their transitions. 4.48% have no capacity to support transitions at all. All right, so time for some reflections, some thoughts that we have pulled together after looking at the data and collaboratively discussing it a little bit. Actually, I'm sorry, I'm looking at the wrong slide. I think you have the right slide. Let's look at organizations by membership. Respondents showed interest in collaboration. This survey question asked, are you currently participating in any of these networks, alliances, associations, or working groups for supporting family-based care? Many respondents indicated that they do participate or work in a wide variety of coalitions, alliances, and networks. 85% cited specific network affiliations, while most reported awareness of or connections with Better Care Network, 55% of them, and CAFO, 45%. 15% of respondents reported no affiliations or connections, and you can see how some of these other organizations lay out on the chart in terms of their affiliations. I think it's also important to point out that 91% of respondents have a strong desire to share the lessons they've learned, and to also caveat that by saying that the other 8.9% just declined to answer that particular question. All right, now some time for reflections. We have a few thoughts we've gathered as we've reflected on the data over the past couple of months. Please remember, I want to remind you, since I kind of went through these slides pretty quickly, that respondents represent a minimum of 1,500 organizations receiving transition support in 61 countries. So if we consider how many children may have lived in each of these residential care centers, say anywhere between 50 to 100 as a ballpark, we might assume tens to hundreds of thousands of children have been reintegrated as a result. That's kind of now for having conducted the survey indicated a recognition of a lack of transitioning support providers. We must now also recognize that the survey discovered that there is significant experience. This is an asset to be considered, I think, for future planning and increasing access to transitioning support providers. However, almost half of these experienced providers, 46% of them, also report lacking the capacity to support full transition, even if they're resourced to do so. That leaves approximately 44% of organizations who currently have the ability to support the entire transition process if they have the resources to do it, while a very small percentage, 4.48, report that they're able to support full transitions right now without additional resources. With 5 million children currently estimated to be in residential care settings and rising international pressure, for those children to be reintegrated support providers. However, there are 40.3% that are perhaps primed and ready to be trained and their capacity built. Of those with experience and expertise to support the full transition process, the majority report needing to be further resourced. Funding for transition support providers should therefore be considered an important need for building capacity to respond to the growing demand for their services. There's a great deal of transition experience across a wide range of activities. Most respondents report having supported a wide range of activities. However, over half also report a lack of capacity to support all the stages of transition in the future. Perhaps organizations and individuals providing support for transitioning is out of necessity because the services were needed. In other words, we did everything related to transition because it had to be done. But they were perhaps better suited currently to provide support to specific activities and not others. Organizations may be supporting most or all transition activities because they believe there's no one else to help, or perhaps there is no one else accessible to help with these activities. These first two data points are worthy, we think, of further exploration to determine the reasons behind the contradiction. Having said that, we see a considerable need to build technical capacity of transitioning support providers. We do need to do a lot more research to assess which areas of transition support need the most technical capacity building, where that capacity building is most needed. And lastly, encouragingly, results indicate almost all respondents have a strong desire to continue to support the work of transitioning, would like to have their own capacity built to do so, and a strong desire to share the lessons learned through their own experiences supporting transition from residential care to family-based care. Respondents also seem to be willing to receive from and contribute toward capacity building. So I think there's a lot of good news to report. I think there is a lot of further research that we could pursue, but that's the data that I have to present to you. And now I'll throw it back to Ellie.
Thank you, Laura. And it's a lot of information. Again, we will be releasing a report, but hopefully you were able to track, and we would love for you to bravely unclick your mute button and ask questions and reflections. Again, the areas that we'd like to hear from you are around potential implications of this data. So you heard Laura presenting some of those implications at the end that we've considered in looking through the data, but we'd like to hear your thoughts as you went through the data as well. Questions you have specifically, and then any future areas you'd like to see exploration. And then after you finish asking your question, please remute yourself so we're able to hear everyone clearly.